Schizophrenia is one of our psychiatric disorders, which we diagnose based on a constellation of signs and symptoms. There is no specific blood or brain test for schizophrenia, but rather we make our diagnosis based on a set of clinical descriptive criteria. Schizophrenia also includes what we call negative symptoms as well, things that should be present that are not. So that includes things like a range of emotional expression, taking pleasure in activities, productive speech, and social drive. Insomnia, although it is not a part of the diagnostic criteria for schizophrenia, it is an extremely common symptom in our patients with schizophrenia that often persists even despite treatment. Studies would suggest that approximately 1 in 4 to 1 in 2 patients with schizophrenia will complain of insomnia as part of their constellation of symptoms. What we know from literature outside of schizophrenia is that insomnia is a risk factor for suicidal ideation and suicidal behavior across a variety of psychiatric disorders. And that literature was probably most well established initially in depression, but it exists again in a variety of conditions, and we've been investigating its relationships in schizophrenia as well, finding throughout really the different phases of the illness that insomnia appears to be associated with an increased risk of suicide in our patients with schizophrenia. Clozapine is our gold standard antipsychotic medication for what we call treatment-resistant schizophrenia. And treatment-resistant schizophrenia can be generally defined as patients who have had trials of at least 2 other antipsychotic medications of an adequate dose and an adequate duration and not had clinically significant improvement in their symptoms. Clozapine is the only antipsychotic that has a specific indication from the US FDA for suicide prevention. So some very interesting head-to-head studies show significant benefits of clozapine compared to other antipsychotics in terms of reducing suicidal ideation and suicidal behaviors in our patients with schizophrenia. In my clinical work, treat a lot of patients with schizophrenia and prescribe a lot of clozapine, and what we notice with that, even compared to other antipsychotics, which tend to cause a lot of sedation, clozapine is particularly sedating. So it's often given primarily at bedtime because it makes people very sleepy, and people can have a significant duration of sleep at night with clozapine. And so one of the questions then that resulted from both the previous research that we've done as well as my clinical experience is that what the literature shows? Do we see less insomnia with clozapine? Because that's certainly been my clinical experience, but we wanted to back that up with the data in the literature to see if that's indeed what studies have shown. And that's exactly what we confirmed with our study, that there was a significantly decreased odds of the patient still having insomnia when they were treated with clozapine.